Hello everyone, I am Dr. Diron. Today I'm going to talk about one of the important topic. It is related to antipsychotic drug with elderly people. So these antipsychotic drugs we can classify into typical antipsychotic drugs and atypical antipsychotic drugs. When we talk about the typical antipsychotic drugs and atypical antipsychotic drugs, the typical antipsychotic drug have more severe side effect compared to the atypical antipsychotic drug. For example, typical antipsychotic drugs have a more severe side effects such as extrapyramidal effects. So they have extrapyramidal side effects. For example, they will be having Parkinson's. They may develop Parkinson's disease because of this typical antipsychotic drug. They may have this tardive dyskinesia. They may develop ataxia. They may develop acute dystonia. So these are the extrapyramidal side effects that can arise because of the use of typical antipsychotic drug. But when you compare this to atypical antipsychotic drug, they will not have this extrapyramidal side effect like this typical antipsychotic drug. But because of this, we always try to prescribe atypical antipsychotic drug for these elderly people. But even when you prescribe that, there are some side effects from the atypical antipsychotic drugs, such as increased risk of venous thromboembolism, increased risk of strokes, are very important to monitor the people following the treatment or on the treatment. So when you consider this atypical antipsychotic drug for elderly people, you have to have a consideration regarding developing stroke, venous thromboembolism. So you have to monitor the patients and you have to alter the drugs according to that. So this is the commonest side effect from the atypical antipsychotic drug. But there are some side effects also, such as sedation, such as weight gain, such as they will have these antimuscarinic side effects, dry mouth and all. So remember, because of that, we are supposed to monitor the people, elderly people, when they are on atypical antipsychotic drugs, especially consider this risk of venous thromboembolism and the stroke development. So hopefully this video helpful to differentiate the importance of typical antipsychotic drug and the atypical antipsychotic drug in elderly people, and what are the facts that we are supposed to consider in atypical antipsychotic drug when we prescribe elderly people. We always try to avoid the typical antipsychotic drug to avoid this extrapyramidal side effect. So we avoid that, and that leads to the choices of atypical antipsychotic drug. And while giving, always have an eye on the patient regarding the development of venous thromboembolism and stroke. We'll see you next video. Thank you.